Hello guys, welcome back to Medical Buddy. Today we are discussing about the beta adrenergic blocking drugs. It's divided into two. It's non-selective and cardioselective. Non-selective is again divided into three: without intrinsic sympathomimetic activity, with intrinsic sympathomimetic activity, and with the alpha blocking property. Example for without intrinsic sympathomimetic activity are propranolol, sotalol, timolol. Example for with intrinsic sympathomimetic activity are pindalol. Example for with alpha blocking property is labetalol and carvedilol. And coming back to cardioselective, example for cardioselective beta blocking drugs are metoprolol, atenolol, acebutolol, bisoprolol, esmolol, betaxolol, celiprolol, and nebivolol. Moving to the next classification is generation-wise classification of beta blockers. There are three generations: first generation, second generation, and third generation. In first generation, it includes older and non-selective beta blockers. Example are propranolol, timolol, sotalol, and pindalol. And example for second generation beta blockers, it includes beta 1 or cardioselective beta blockers. Example are metoprolol, atenolol, acebutolol, bisoprolol, and esmolol. Third generation beta blockers include beta blockers having alpha blocking or vasodilator property. Examples are labetalol, carvedilol, celiprolol, nebivolol, and betaxolol.